Good morning, Dr. Eric Klajinsky here at Fanwood Back Relief Center. Today we're going to talk about the effectiveness of manual therapy for carpal tunnel syndrome. Carpal tunnel syndrome is a condition where the mobility of the median nerve that runs through here in your wrist gets compromised, typically by inflammation of the surrounding tendons. It's a small area, this tunnel here. You got tendons that run through there. You have the median nerve and other nerves. You have blood vessels all run through there, and when that area gets inflamed, it will cause irritation on that median nerve and restrict the mobility of it. There's a lot of different types of approaches conservatively to helping patients with carpal tunnel syndrome, and they should all be exhausted before surgery. Some of those things are splinting, especially at night. Putting your wrist in what's called a cock-up splint, which helps to traction that area a little bit, take some pressure, allow the inflammation to go down some. Steroid injections as well to decrease the inflammation. There's electrical stimulation, manual therapy and manipulation. All these things are very effective for reducing that inflammation in that tunnel, and not only that, restoring function so you can do the things for work or the hobbies you like that are affected by carpal tunnel syndrome. So in our office, we do a lot of different types of manual therapies. Everything from stretching of the wrist and the forearm to activator adjustments in the bones and the carpal bones in the wrist. Also, there's different types of soft tissue therapy that we do, like grafting, using an instrument, gliding it across the area and removing any adhesions in that soft tissue there. There's other instruments that we use as well. Cross friction massage. There's all different types of stretching that you can do for the wrist, both active and passive. But we don't want to forget that median nerve starts somewhere, and it starts in the neck. So if it's compromised along that chain anywhere, it can cause these types of symptoms. So we look at the whole picture, from the neck down, making sure nothing is obstructing any of that nerve tissue, make sure everything's in its best alignment and functioning without any restrictions. There's also other guidelines we recommend. We have some nutritional guidelines, supplementation guidelines, some rest guidelines, at-home stretches that you can do. All these things can help minimize the effects of carpal tunnel syndrome on your daily, personal, and work life. And we try to exhaust all options before going in and cutting and causing any further disruption or scar tissue in that area that could even cause more problems later down the road. Hopefully this information is useful for you. If you have any questions about carpal tunnel syndrome or any symptoms that you might have been experiencing in the arm, in the hand, in the wrist, and the fingers, just give us a call, shoot us a message, and we'll be happy to help you or point you in the right direction. That's all we got for today. Let's talk to you next time.